Welcome, everyone. Thanks for joining us for our session today, diving deeper to understand behavior. While we're waiting to get started, please take a second to type into chat where you are viewing us from today. I know you're all probably from Virginia, but we'd love to see what parts of Virginia are represented. All right, so thank you again for joining us today. My name is Patty Eitemiller, and myself, along with Lisa Terry, my co-presenter, are going to spend some time with you guys today talking about one of the hot topics in early childhood. That topic is behavior. About 2.5 years ago, Lisa and I were both trained as trainers for the 0 to 3 curriculum called the Growing Brain. The full curriculum is comprised of 7 3-hour units focusing on early brain development, factors that influence brain development, and parts of the brain that impact each area of development during those first 5 years. The behavior unit is just one of those units, and we'll take time digging into understanding behavior today. And we've also incorporated some information from some of the other units as well. So let's get started. So we wanted to also, since we're not in person and this is also a recording, Lisa and I are much more energetic and happy when we're live and in person, but hopefully you'll get some of our energy through this recording. But we wanted to introduce ourselves a little bit about who we are personally and professionally before we got started. So like I said, my name is Patty Eitemiller. I am an infant development specialist for the city of Alexandria in Virginia, up in Northern Virginia. And I spent over 15 years working as an infant development specialist for the early intervention program there. And for the last 2 years have been doing professional development and training for our Head Start program, our early interventionists, as well as our childcare providers, and also doing some monitoring of our Head Start program. When I'm not at work, which is now completely at home or has been for the last year, I try to practice yoga regularly. A lot of that has obviously been virtually in the last year, like most people. I work part-time at a winery in Northern Virginia just for fun because I love wine. And I also love to travel and have been to 41 countries and 39 states and counting. So when I can combine all three, that's a good day in my world. So Lisa?
Well, I can't say that I've traveled as much as you, so I'm not as exciting in that aspect, but my name is Lisa Terry. I am an early intervention professional development consultant in Virginia. Prior to this role, I've also been a service coordinator, an educator, and a supervisor in early intervention. Some of that actually has taken me into childcare settings to actually provide support as a developmental therapist as well. I'm also an RP ambassador. So if you guys have any questions related to the DEC recommended practices, please feel free and reach out. There's a lot of great resources there. So I would love to be able to share those with you. I am endorsed as an infant mental health family specialist. And so I love talking about all things around social emotional development and how it impacts families. So I'm super excited about talking about this today. I think this is one of the hot topics that people are always interested in. And another reason, I guess, partly because I have 5 kids of my own. And so I think I could probably relate to maybe losing my mind sometimes. But I have 5 kids. Their ages are 7 to 20. My oldest, he just turned 20. So I'm like, I feel like that's like a new era for us now. But my kids have been in virtual learning. They just transitioned back to school. So, as you can imagine, this has been one of those challenging years for us as well. In our free time, we love to find hikes, especially to waterfalls. We like just driving and seeing what we can explore, which is perfect for COVID, right now. But other things, we usually love going to like theme parks and festivals, but that's kind of been a little bit of a halt now. But I love all questions and generating discussion. So I just invite any kind of feedback, any kind of questions, feel free to contact me or Patty directly.
All right, thanks, Lisa. So I have the travel bug because I don't have all the kids keeping me at home. So
Right.
Lisa's going to join me sooner or later, hopefully.
Sooner, I hope.
Yeah, hopefully. So I think we dream of presenting all around the world, or at least I know I do. So hopefully we'll be taking this on the road further than just through Zoom sooner or later. But let's go over what we're going to cover today. So you'll see our learning objectives here on the screen. We're really going to talk about how the brain influences children's behavior, which is something we want to keep in the back of your mind as we go through our presentation. We'll talk about 3 key factors that influence children's behavior and how those factors guide can guide your early intervention sessions with children and families. And then the biggest crust of what we're going to talk about is the root causes of challenging behavior and some strategies that you can use for coaching caregivers and children with behavioral challenges. Next slide. So our first activity, when we do these presentations live and in person, you'll probably figure out as you listen to this, is Lisa and I are pretty engaging. We don't want to spend the whole time talking. We want you guys to participate and really give us the information that you know and what you want to learn as well. So recordings are definitely different for us, but we're going to make do with what we can.
It's interesting, yes. So we want you guys to type in chat, and we'll be monitoring chat to make sure that we respond to you.
Right, exactly. So here's your first opportunity to type into chat. When I say behaviors, type the first word you think. It could be positive, it could be negative, but the first thing that comes to mind when I say the word behaviors, and I'll give you a second to do that so we can monitor what you're doing, typing, and respond.
Yeah, and I would probably say like hitting, or if my son, when he's having behaviors, like I just want to run away and hide.
Screaming, throwing,
Yes.
tantruming. Yep.
My stress level is getting elevated.
Which is interesting because we both went to the negative route, which will be interesting when we see some of the spot responses in the chat, if anybody comes up with some positive words. Because we want to think about, when we think about behaviors in a general setting, or in general, behaviors are not always going to be negative. It's not always going to be a negative influence. It's not always going to be a negative action. But a lot of times I think that's where we go first, because behaviors tends to have a negative connotation when we think about, oh, that child has behaviors. And we're going to automatically think, oh, these are things that are going to be challenging. But behaviors are also positive as well. So Lisa, can you think of some positive behaviors that you would come up with, or things that you might name that would actually be related to a positive behavior?
Yeah, like sweet cuddles, being like empathetic to like his brothers. Like I love it. The other day, like he was so sweet, and he like carried his brother's book bag. Like those are things I'm like, oh, like that makes my heart melt, and then my stress isn't elevated.
Yeah, exactly. Well, I think of, like, I have cats. I don't have kids, but I think my younger cat is so snuggly. Like, he has the most quiet demeanor, snuggly behaviors. Like, he just loves to cuddle. So that's when I would say, okay, Grayson has, and it's funny, she has a kid named Grayson. I have a cat named Grayson. So,
And that's my youngest son.
Yeah, I know, it's a very popular name, but Grayson just likes to cuddle. So that would say that his behaviors are very sweet and calming and things along those lines. So when we think about behaviors, again, don't think just the negative, but also think the positive, because when we talk about the definition of behavior, it's the way that someone acts or conducts themselves. So when you laugh, or when you smile, or something that's funny that your colleague or a family member or a friend said, this is your action in response to what they're doing, what their behavior is. So like I said, we're not going to focus just on the challenging behavior, but we're going to focus on the meaning behind behaviors today. Because in order to understand behavior, we need to focus on the why behavior happens. And when we think about children or even adults, it's really important to remember that all behavior has meaning. And children do not just act badly, and I'm going to put that in air quotes, act badly on purpose. All behavior is driven by the brain, which we'll talk about a bit more throughout the session. Next slide.
All right, so let's really put this into context, and we're going to introduce Fatima and Zane, and that's going to give you just some background information to really think about behaviors and think about some of those whys and what might be going on. So meet Fatima and Zane. Fatima referred her son, Zane, who is 22 months, to early intervention for language concerns. Recently, however, since COVID-19 began, Fatima became more concerned with his behaviors. We see this a lot of times, especially in early intervention. He's always been described as strong-willed, but his behaviors are getting worse. Zane is hitting his mother, throwing toys at the window, and screams for almost an hour when he becomes upset. Fatima struggles because she is now working from home. Zane's childcare was temporarily closed for a period of time due to COVID. In addition, she's balancing his early intervention sessions via telehealth. Her husband, he's continued to work outside of the home, but his hours have actually increased since COVID. Recently, Zane returned to childcare and his teachers expressed concerns to his mother about his behavior. In truth, Fatima is stressed. Zane has had a lot of disruption in his routines, and they're really just trying to get through the day to day activities. So, I want you guys to go ahead and type in the chat and think about this. How do you think all of this could be related to Zane's new behavioral issues? Patty, what do you think?
I think, you kind of hit it on the nose. There have been so many changes with this pandemic. I think, now we're almost a year into this, which I don't think we ever thought it was going to last this long. But so we've probably adapted to some of those changes. But the kids in the beginning, as adults, we had our own adaptations, but kids had a lot of challenging times adapting as well. And we already know Zane has some communication delays. So he's probably not able to communicate, hey, I don't like this change. I don't want to be home all the time with you, mommy. Mommy, you're stressed. And the thing about kids is they pick up on adult stress. They feel it, they bring it all into themselves and they don't know what to do with it because developmentally they're not quite there yet to be able to understand how to manage it. So, I think Zane's behaviors of hitting and throwing and even his acting out now that he's returned to his childcare are coming out because things in his world just got rocked and he doesn't know how to bring himself down to be able to self-regulate and calm back down and be able to understand how his world's changed and that security that goes around that when our routines change so much that we don't know what's happening. So we're going to talk about self-regulation and self-control a little bit later in this presentation, but I think for Zane, a lot of that is that his developmentally is not quite where he needs to be to handle all these changes. And he doesn't know what to do with that stress that he's getting, those feelings that he's getting from his mom. So
Yeah, and I think, I think you're absolutely right. And you hit on a lot of things. But I mean, first and foremost, like we're living in a global pandemic. And
mhm,
so that
mhm.
really impacts the whole family. It also impacts you as teachers. Like this is something that is adding a lot of additional stress to everyone's life. Yes, and Zane has those developmental issues, and that can cause problems, especially communication problems. It can make his confidence go down. And a lot of his routines are disrupted right now. His dad's working longer hours. So there's so much going on. And his mother's stressed. Like his mother's trying to balance, working from home, having Zane here. He just went back to childcare. And now the childcare is saying that he's having behavioral issues. Like that's stressful. It raises my stress level thinking about this family because that's hard. That's a hard thing for them to go through and then have to worry about, well, what happens if they continue to have concerns with his behavior? Like, what do we do to best support him? And one of the biggest things is when we're stressed, you can't access that top functioning and you can't really think and problem solve. And so we really have to look at the whole picture of what's going on behind those behaviors and really to understand. So if you take anything away from today, just make sure that you remember how much stress impacts behaviors and how important it is to really engage the families to understand, okay, what's really going on? I need the full picture. All right, Patty, I'm going to move it to you so we can talk about the 5 R's.
Excellent, excellent. Good points, Lisa, too. All right. So the 5 R's is actually out of the second unit from the Growing Brain curriculum. So like what I said in the beginning, we pulled some of the information from the full curriculum to merge it into the session because it really helps us understand behaviors. But it's something that I think Lisa and I, when we started really learning about the 5 R's, because it was a new theory to me until a couple of years ago, but it really, really can help you understand the whys behind behavior and the why of healthy brain development as well. So there are 5 R's, they're all listed here on your screen, and we are going to break them down individually and talk about them each separately as well. So Lisa's going to start with relationships.
Relationships. I love talking about relationships
Mhm.
because one thing that we know are that trusting relationships are needed for a child's life, which means that you, as a child care provider, possibly a child care director, like all of these relationships with these children, it matters. And it's really important that you build and establish that trusting relationship. Now, research shows that children only need one positive, strong relationship that's a safe and secure attachment that's really essential for healthy brain development. But again, those trusting relationships are really important too. And so that's something that we really want to think about when we're thinking about behaviors, especially because it's easy to risk or put that trust at risk when we're dealing and handling with any kind of behavioral issues that are coming up. But really, relationships are really important because that's what helps a child feel safe and secure. And when they feel safe and they feel secure, and their physical and their social emotional needs are being met, then they feel more confident to go out and explore their environment. And that's because they know that they can come to seek those caring adults that are being responsive to them to comfort them if they encounter any kind of emotional distress or if they need any help. So, when this happens and the child has that trusting relationship, then children can really focus on the most important task, and that is learning through play and developing those positive relationships with other adults and children as well. And um, children who don't always have this opportunity, they really experience poor brain development and they tend to exhibit behavioral issues. So, this is really important to remember, especially. You have to know who the children are that are in your care. Have they been placed in foster care? Have they had numerous caregivers throughout their life? That's important to know because that can actually impact how much they trust and adjust to a situation. So it's really important to think about those things. Also, for newborns, one of the biggest things to remember too. So this is kind of pulling some of that infant mental health background, but I love talking about like the grief and pregnancy. So I want you to imagine this. Picture that beautiful moment that a child is born and brought into this world. We've all seen the commercials, we've all seen movies, right? And so you can imagine the baby being born and placed on the mother's chest. And oh my goodness, the parents are like so adoring and they're so loving. And it's like this instant bonding moment. But in truth, that doesn't always happen. And the reason, because some mothers might actually experience a loss of their pregnancy. And so when this child's born and brought into this world, they might not have that instant bond. And they're thinking, because they've seen all of those wonderful, beautiful moments before, like, what's wrong with me? Am I not a good enough parent? And so they can experience postpartum. There can be a lot of different things going on. And so, even in those moments, you have such a crucial role because you can actually set it up where you are encouraging those bonding experiences. You like really paying attention and observing what's going on for parent pickups, or when they're dropping their child off, the things that you say, the words you say, and the actions that you do are important. So, you, for example, might say, "Oh, Johnny, your mother's here. Oh my goodness, she loves you so much." And, you could say, like, "Oh, like give him kisses," as you're handing him off in a loving way. And so, you're really building and nurturing that relationship with the parent, too. So, some other ways that you can build strong relationships with children in your care, this could be tuning into the child's likes, their dislikes, learning how they like to be comforted, figuring out their strengths as well as their challenges, and really providing those regular routines so children know what to expect. One of the biggest examples that I can give from being in a childcare setting and providing services, there was a child who was having a lot of behaviors, and he was just always, he wasn't always engaging in the activities. For example, like circle time, he was just kind of like standoffish. He would walk around the room, and he would cry. And transitions were really hard for him, and he would just cry and cry. And there was other children in that classroom that were brand new, and they would cry and cry. 2 weeks later, I go in there, and the same children are crying and crying, and I'm like, oh my goodness, like my heart, the infant mental health part of me is like, my heart is hurting for these. But it's because they're not building those trusting relationships either. And so I think those are some of the things that we're going to talk about today that we have to really reflect on what's going on with that child and how can we support them. And when I talk to the childcare providers, they're like, if we picked up and hugged every single child all the time that cries, we're never going to get any work done. And so we really worked on, okay, well, how can we still build that trusting relationship? Because you don't want to kind of like have a child come up to you and they're crying and you're just like, okay, go sit down, because that damages that trusting relationship. So how can you really meet them halfway? How can you, decide what to do. And so like we decided, okay, like they're going to give him one big hug before they try to redirect him all the time, and use some of those loving words. All right, Patty, let's go on to the next one.
Excellent story, Lisa. I think that really kind of drives home the whole importance of trusting relationships from the very, very beginning with our little guys, particularly our infants, because that's where it all starts. So the next R is for responsive interactions. So I want you to take a minute to think about a time when someone really took time to listen before he or she responded to you. I'll give you an example. When I was in graduate school many, many years ago, in one of my classes on speech and language development, we were told to partner up and engage in a conversation. But to get a sense of how long it takes for a young child to process what we're saying, we were told to count to 5 slowly before after the other person talked before we would respond. So if you remember, like when you were a kid, you would go 1 Mississippi, 2 Mississippi, 3 Mississippi. We were told to do that to 5. So the person might say, "Hi, how are you?" And then we would go 1 Mississippi, 2 Mississippi, before we would say, "I'm doing fine, how are you?" Um, so when you think about that, think about the last time you might have told a child to, I don't know, put the napkin in the trash, or their cup near the sink, or their shoes by the door. Do you repeat that word direction multiple times over and over and over and over again until they follow it? Or do you give it to them once? And then do you count to 5 slowly before you repeat it again? So you give that child time to respond, for them to process what you've said and actually understand what that direction is, and then actually follow through with the action and the task. Until this pandemic came along, especially here in Northern Virginia, and Lisa's in Virginia Beach, it's a high paced area down there too. We were living in a very, very fast paced society. We were always on the go. And I got a true sense of that just yesterday when I took my car in for service and realized I had only done 5,000 miles in a year when I used to do 20 to 25,000 miles in a year. So that kind of gives you a sense of how much on the go I was and before this last year. So what we have to remember when we think about that in terms of children, so the child's brain does not work as fast as ours does. It's still developing, particularly in those first 5 years. So while their brain is still developing, that's when we talk about those responsive interactions. And when we think about that, I want you to think about how it makes you feel versus how that makes us feel when we are actually truly seen, truly heard, and truly valued. When children feel genuinely seen, heard, and valued, they feel safe and secure, which is a key component to those strong relationships that Lisa just talked about and healthy brain development. Responsive interactions mean that we follow the child's lead by reading their verbal cues, their nonverbal cues, that back and forth reciprocal exchanges that we have, and they're not one-way interactions where the adult tends to tell the child what to do and how to feel. We're actually reading what they're telling us as well, which makes that then a responsive interaction. While we can't always know exactly what a young child is thinking or feeling, because obviously they're still developing, especially those pre-verbal child, we want to be in tune with how they're feeling and what they're thinking to get a good sense based on any kind of pre-verbal cues that they're giving us, so that we can help keep trying to understand those needs and characterize those responsive interactions. So when we think about those back and forth interactions, you've probably heard the term serve and return. Kind of like a game of tennis or volleyball where a child serves the information to you and then the adult responds based on the cues that they receive. The child and the adult go back and forth, responding with each other's gestures, sounds, facial expressions, and later words, which really defines responsive interactions. So Lisa's going to take us through the next R, which is respect.
RESPECT. All right, I'm not going to hurt your ears, but that's what I always think of when I hear about respect. That's the first thing. Okay, so respect. And it's so funny because before we even talk about this, I have not honestly always thought of respect for a child. And I think that we as adults, we're guilty of that because we think of respecting other adults, but we don't always think about respecting a child. So what does that mean? It means that we are going to treat that infant or that child as valuable individuals whose efforts to communicate their preferences and their needs are important. So what they're saying and what they're doing is important. So think about the last time that you felt disrespected. I want you to think about that. Patty, what about you? How did you feel when you felt disrespected? What were your feelings?
I think my first thought is I feel devalued. Like my opinion or my thought didn't matter and it wasn't important to whoever that other person was that was talking to me. And then, depending on the situation, I think I would have felt frustrated or angry, or especially if it was something that might have had some sort of emotional tie to me. Like if I said something that was really kind of sparking an emotion in myself and somebody didn't respond to it or just didn't even hear me, I
Mm.
would probably get angry or frustrated and probably really upset. So that's me as an adult. So yeah,
Okay.
definitely
So
devalued.
angry, frustrated, devalued, those are big,
Mhm,
big
mhm,
feelings. Those are big emotions.
mhm.
And when we feel those big emotions inside, our body wants to react and respond. Obviously, Patty, you're an adult, and so you know through experience and through life experiences that okay, I need to pause for a minute and have enough self-control to
You
really
mean I can't go through a temper tantrum in the grocery store when they run out of ice cream
I
or
mean,
they
you
don't have
can,
eggs?
but can you just make sure that we're
Man.
all there to watch if you do it? Because I want to
Well,
see that happen.
early on in this pandemic, the whole toilet paper thing,
That's true. People might have been fighting over it. And but that's the biggest thing. That those are big emotions. And so we want to react. And children feel those big emotions when they feel disrespected and they do react to it. They don't have that self-control yet. And so you have to remember that young children, they're reacting based off of their emotions. That's a key thing for us to keep in mind. And it's really important for us because I know that we're trying to, incorporate positive discipline and figure out, okay, well, how are we setting those limits and addressing those challenging behaviors in ways that are teaching and guiding the child? But we have to do that where we're so pay close attention because this is important. We have to make sure that when we're doing it, we are teaching and guiding them versus punishing or shaming a child. There is a huge difference teaching and guiding versus punishing or shaming. Can you imagine the difference of how that child may feel when we're punishing or shaming them? So, what we're doing essentially is we are showing empathy for those strong feelings. That children have. And remember, empathy is one of those skills that are learned. It's something that it's taught. Not everybody has it. There's a lot of adults that don't have empathy. And so it's one of those skills that you have to really model and still work on. So if you're a child care director, I encourage you to model that for your teachers too, because not everybody has those empathetic responses. Um, but we really need to look at seeing that misbehavior as an effort to cope with a challenging situation that requires our understanding and our support. That child's trying to communicate something to us. And so we need to respect that and figure out, okay, how can we best support this child? So we'll explore more of those strategies like later as we continue on. But here are some ways to show respect. So we can understand that the experiences a child may have outside of your care um, can impact them. Respecting their preferences, especially any kind of like sensory sensitivities, like say that they have sensitivities to loud noises. Okay, well, we know that we're going to do a loud activity at circle time, and little Johnny is really sensitive to loud noises. So I'm going to move him more towards the back. So that way we're keeping his, respecting his sensory needs too. We can understand where a child is developmentally. So remember going back to Fatima and Zane, we know that Zane is having those communication issues and he's having a hard time building his confidence and using his words to communicate his needs. So we're making sure that we're being patient, that we're having realistic expectations for behavior. And a great thing to incorporate, a great strategy is to give a child choices in all things that you're doing. So that way it's not like you're telling them, hey Patty, go here, go do this, go put this away. Instead you're saying, oh, do you want to put the dinosaur away or do you want to put the book away? So you're empowering them, you're giving them a choice. There's a big difference in how we're using those words versus telling somebody what to do all the time. If somebody told me what to do all the time, like if my husband were to try to tell me what to do all the time, I don't know he better run because it's not going to be pretty. It's not a great feeling when somebody's telling us, but giving choices that empowers and that's showing respect. All right, Patty, let's go ahead and talk about routines.
All right. All right. So the fourth R obviously is for routine. So I want you to think about your morning routine. What do you do when you first wake up? I'm going to share mine so you get an idea. I get up, I go to the bathroom, I brush my teeth, I take a shower, and I even shower in the same order by washing my hair first every single morning. Imagine if somebody else took over that routine and changed it every single day. So what you were doing was going to change and you had no idea what to expect the next day. I think back to, gosh, over 20 some odd years ago when I first started in this field, and I worked at a residential school, mostly with nonverbal adolescents and adults in group homes. And they all had no control over their routine. Well, they did have control, but they basically did what we kind of incorporated for them. And they were nonverbal. So it was really difficult for them to tell us what they wanted to do without finding other means to do it. And once we had a routine established, we tried not to change it because if it was a routine that they were very comfortable with, they didn't have the verbal capacity to communicate when they wanted things to be changed, or they would often act out or demonstrate some of those challenging behaviors when we changed that routine without them knowing that it was coming. So it kind of gives you that sense of what it feels like to be person centered and really understand what that person and what that child needs and what they want their routine to be and what they're comfortable with and what they are going to expect every day, which is when we look at little guys in childcare and even in home settings, we all have a bedtime routine for them or we have a mealtime routine for them. And we do the same thing day in and day out. That helps establish some of that security that a child understands with their caregiver when they have those same routines that follow that same pattern every single day. However, we did have this pandemic that rolled up into our lives a year ago, and our routines changed for everyone. We go back to Fatima and Zane's example in the beginning. Their routine changed, and Zane had some challenging behaviors that came out of that. So, in some ways, we felt out of sorts. His mom felt out of sorts. His dad felt out of sorts as we adjusted to our new normal. So, even though children rely on these routines that we create for them, just like we do as adults, it provides that sense of safety and security, and it can be adapted if we go through those transition processes is equally and keeping in mind that we're going to let them know what's going to happen next. But those predictable sequences of events that happen every day in the same way also help build the brain connections that support memory and organizational skills, which is really, really important. It's that whole phrase of when you repeat something over and over and over again, it then becomes ingrained into your brain. So these routines that we set up around mealtime and bedtime and other routines that we do out around the day with these kids are really, really important to help reinforce those brain connections that are happening. There are millions of brain connections that happen every second in the first few years of life. So those are things that we want to make sure that we keep in mind. But again, like I said, it also helps build a sense of security, helping children to know what and how and when things will happen. And they create that safety and calming of the functions of the brain that allow children the greater access to working memory and focus attention, which is really, really important as we get into those older years when they go to school in person after the pandemic. So let's go to the last star. Lisa's going to take us through repetition.
Yeah, the only thing I was going to add that I was thinking as you were talking, Patty, was the learning opportunities.
Yes.
Routines, it provides so many different learning opportunities. So, for example, like if you're having snack or meals, or you're washing your hands, you can break down all of those little steps, but those are opportunities for you to practice
Mhm.
something with a child every day. So you know that a child that you do hand washing with every single day, they're like, okay, they got it, they're used to it because they know what to expect. You've set it up for them, but you can incorporate other strategies. So if it is a child with a communication delay, for example, and they want more milk, then you can model and sign milk for them. And that's an opportunity for them to learn, which does take us right into repetition, because repetition, repetition, repetition is everything. And you can add that a lot with your routines. Because repetition, exactly what Patty said, that's where our brain establishes those connections in response to experiences. So the more something, an experience is repeated, then the stronger that brain connection is to that experiences. So reading the same stories, singing the same songs, going on the same walks, that stimulates the senses, the muscles, all those skills that are involved in those activities. So we know that cognition, language, physical skills, and social emotional abilities, those can all be supported through repetition. So I want you guys to do something for me. I'm going to say a phrase and you're going to fill in the blank in your chat box. So type in the chat and fill in the blank. Ready? And I know you guys all know this, so you're going to get it. Okay. Have you ever heard of the phrase practice makes blank? Type it in chat. I can almost imagine everyone saying perfect, right? Perfect.
I'm hoping we're going to get all these perfects just pop,
yes.
pop, pop, pop.
Perfect, perfect, perfect. But in truth, I want you to change the way you're thinking about that. Practice doesn't make perfect. Practice makes permanent, permanent. Because the brain needs opportunities to try something over and over again to really cement those neurological connections. So we repeat to remember. However, I do want to caution you because introducing and making children repeat activities or skills that are way beyond their reach, that is not going to build a positive brain connection. Rather, it's going to cause that child stress. And then they're going to begin to associate that activity with negative emotions, which actually will interfere with their love of learning. So for example, I know everyone loves flashcards, but let's break away from flashcards because that adds a lot of pressure to children. How else could we teach children to learn numbers, for example? We can have them help set the table and they can count. They can, if you have stairs anywhere, they can go up and down the stairs or a step and count that. They can march during transitions. I love this, especially in a childcare, because you guys have a lot of the transitions, but marching and where they're stomping their feet and march, 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 or they can count 1, 2, 3. And so they're getting a lot of that heavy input and that heavy footwork out too, but it's also setting them up to know what to expect, and there's learning going on. So this all goes back to that neuroplasticity, and we're giving children numerous opportunities. So if you're really truly looking at the child as a whole, think about these 5 R's. Remember relationships, responsive interactions, respect, routines, and repetition, because they're all important for healthy brain development.
All right, so now as we moved out of the 5 R's, which is the first third of our presentation, we're going to move into the second section, which talks about the 3 key factors that support brain development and the root causes behind behavior. So I mentioned in our learning objectives, we're going to talk about the why about behavior. What is the why? What is the meaning behind behavior? And there's 3 key factors. They're all on your screen: development, temperament, and environment. And we're going to explore each one of those more in depth shortly. But first, let's think about examples of toddler quote unquote behavior. Why might a toddler bite? Maybe to keep others at a distance because he doesn't like it when people come close, or out of frustration, or a strong need for oral motor stimulation, and the experience of biting is soothing to his sensory system, or he can't communicate. And that's the way he gets a response from another person, by biting them and getting them actually to respond to him. Here's another example that you might not think about as often, but why might a toddler be a loner? It could be that he or she has a temperament where the child is slow to warm up, or he or she may have a sensory processing challenge and is having trouble decoding other children's actions and intentions, making social interactions very uncomfortable. And then we also have, we need to think about the root cause behind that behavior to determine how we would respond, because it's our response that may differ when you understand what drives the behavior and what's the behind the meaning behind that behavior. So let me ask you, Lisa, what other factors might you take into consideration when trying to understand the root causes behind a child's behavior? And you guys that are listening can also type into the chat as well while Lisa gives me her ideas.
Yeah, I definitely, like, one of my biggest go-tos is probably temperament, because I really want to understand how is that child's temperament? What is going to be their natural response? Because, and we're going to talk about that a little bit more, but I think that's always my biggest thing that I go to is what's going on there.
Absolutely. Temperament is huge. And we're going to do an activity around temperament in a little bit, which I think is going to be helpful for you guys to explore your own temperament and the children that you work with, as well as their parents, depending on what your situation is. But we also need to understand behaviors and having emotional responses is completely normal. This last year is a perfect example for that. we've all been we've all been faced with challenges that we've never ever even dreamed of having before. And we've probably had some very emotional times, and we've probably acted in ways that we might not have acted before because of those challenges, even as adults. But we also need to consider, when we're thinking about children, we need to also consider the caregiver's expectations, the parents' expectations. How do we help parents understand the meaning behind their child's behavior, and how they sit down and keep note of what's going on around that environment that may be the root cause behind that behavior? And we're going to explore all of those questions here a little bit more in depth. So let's first talk about the first key factor, which is development. And I'm guessing because a lot of you are early childhood professionals, I can't remember if we asked in the beginning what your role was, but if you're early interventionists, if you're childcare providers or teachers, or maybe even speech therapists, PTs, OTs, whatever your role is, you probably have a background knowledge of early childhood development if you're working with kids, which is going to be one of the first factors that you're going to look at when you see a challenging behavior in a child. You're going to sit there and go, okay, is this an appropriate behavior for a child, where they're at developmentally? If they're on par developmentally, if their development is delayed, is this a behavior that's very appropriate for their development? So for example, a 9-month-old baby might start to protest when his parents drop him off at childcare. She or he is learning to begin object permanence and understanding that this parents still exist when they're not with her. And another example could be a 2-year-old, starts to refuse to cooperate when it's time to clean up. It could be due to the fact that she's asserting her newfound independence, which is very developmentally appropriate for a 2-year-old. Toddlers need a sense of control, and they need to feel like they can make things happen, which often feels like opposition and defiance, but it's really them wanting to be in control and independent. Which is sometimes really hard to remember when you're in the heat of the moment and they just don't want to do what you want them to do when you want them to do it. They want to have a control of the situation because they've suddenly felt, I need to be independent and I'm big enough because I'm 2 and I can do it all myself. But they're not quite there yet, because we know 2-year-olds can't do everything.
Yeah. You know what, Patty? You know what I was just thinking too when I was looking at this picture, and I was like, another thing is like the children that are teething. Like I was like, I noticed this child's teething, but even like the physical pain that they can feel for other things that are going on, that sometimes can cause temper tantrums, or it can cause they might be biting a little bit more because of that, because they need some of that oral stimulation. But yeah, so I just this picture is kind of perfect for that.
It is, totally. He's cute too. So this one, I want you guys to type into chat at what age, and I'll give you some examples, or what are some choices rather. What age do you think children react based on logic? And go ahead and you can type either 2 years, 3 years, 4 years, or 5 years. Lisa, what age do you think it is?
Well, I guess before I knew the answer.
Before you knew the answer.
I probably would have said, like, I don't know, like, I probably would have said 5.
I would have said older. Yeah. I would have said 4 or 5. The answer is actually 3. So it's important to remember that the major factor in understanding and managing challenging behaviors is that before 3, children are largely driven by emotion, not logic. At 3, they start to have a little bit more logical understanding, which still feels young to me, but that's what this research in this curriculum stated.
Well, you know what, Patty, though, like, what it does make me think of, like how, like we, like as parents, I could say this, but we as parents, like sometimes, like, especially when our kids, like, I remember when my son was like, they're 18 months or 2 years old, and I'm like, you need to do this now, and they don't want to do it. And so I look at it as you're being defiant to me, but it's really, they're just expressing their emotions. And I even am guilty of like forgetting those kind of things sometimes, and so it's just one of those things to keep on the forefront of your mind.
Right. And I don't think we often give children credit for as much as they know as young as they know it. So that's why I think we're inclined to think that they're more logical the older they got, when they actually are pretty darn smart at 3 years old. So they get it. And sometimes we let those behaviors get in the way. So yeah, let's talk a little bit about self-control and self-regulation. So many of the challenges that parents and providers are dealing with in those early years are the development of self-control, which is also known as self-regulation, which I mentioned a little while ago. So let's talk about how the skill develops. So Lisa, when you think about self-control, what kinds of images or scenarios come into mind?
I think the first thing that I think of are my boys being hangry. So I don't know how much self-control that they have in that moment, but that's what I think of.
Awesome. Hangry. It's so funny because hangry wasn't even a word until what, 2 or 3 years ago. And now we use it all the time. Like, yeah, hangry, we all know what it means. But self-control is really, and self-regulation, which are used interchangeably, is the ability to control one's thoughts and actions and attention and emotions and behavior to take steps in order to meet a goal. So when I brought up the toilet paper scenario from months ago when this pandemic started, there were people that were pretty hot trying to fight for toilet paper in the beginning. But in an adult world, in a logical adult world, you can't just go and fight for people for toilet paper, even as angry and emotional as you might get, because it's something that you desperately need. It's not socially appropriate to go and, I don't know, hurt somebody or yell at somebody because you're not getting what you want. Though I think some of that is now occurring with the vaccines, sadly, because now we're kind of shifted into that people are getting really angry. So it's taking us learning to use that self-control and self-regulation to really process that scenario and what's going on and being able to act appropriately and behave in what we would determine appropriately so that we're using that self-control to control our behaviors. Um, for the purpose of explaining self-regulation better, you'll also need to understand that the executive functioning is that set of skills that helps us focus our attention, organize lots of information, put a plan into action, and then have a backup plan as necessary. And when I read that, like I mentioned at the beginning, I like to travel, and I managed to travel last September to Croatia. And there was a lot of research, a lot of planning, a lot of backup plans that went into play so I could pull that trip off safely and appropriately within the regulations that are there. Same thing for children. Children have to figure out how to regulate their emotions, figure out those plans, put those plans into action with all the information that they have, and come up with a backup plan as well. A good example of executive functioning skills at work for a 3-year-old would be the child at a table doing an artwork with maybe some other children. First, he has to pay attention to the instructions that you're providing as to what that artwork or that task is going to be, and not get distracted by everything else going on in the classroom or the home or wherever he is. Then keep in mind the steps of what he's supposed to do for that project. Then manage his frustration when another child takes the colored crayon that he wants to use right then and there. And controlling his impulses as necessary for those strong executive functioning skills. So he has to self-regulate so that he knows that he can wait his turn to get whatever color crayon it was that he wanted, and then follow all the instructions of that art task to be able to complete the task appropriately. So it seems like it's a lot for a 3-year-old, but 3-year-olds can do that, which is pretty amazing when you think about all the development their brain has gone through to that point. So now we're going to talk about, actually, we're going to take a 45-second stretch break because we like to give you a moment to get up, stretch, do a yoga pose or two, and figure out what you want to come back to us in about 45 seconds to a minute. Okay? And this is where Lisa and I would probably be like doing all this idle chit chat while we're stretching if we were live.
Exactly. Okay. All right. Let's come back because we are getting towards the end, but let's talk about temperament. So this is the second of the key factors, remember, that affects brain development. So temperament, that is really defined as how children approach the world. So that's really specifically how they are taking in and responding to their experiences. So for example, some children might rush into new experiences while others might need more time. As you guys know, I have 5 children, so I'm going to talk a little bit about them today when we talk about temperament because they're all different. But my youngest, my 7-year-old, he is a fireball. That's Grayson. And I like to describe him as my sweet and sour patch. He has a high intensity of emotional reactions. When he's happy, everyone knows it. When he is mad, everyone 2 streets down the road know it too. Now, my other son, Benjamin, he is 9. When he was younger, he was super shy around people. He would hide his face every time somebody tried to talk to him. So the important thing to remember though about temperament is it's brain based. So this is not something that I chose for my children or that parents choose for their children. It's not something that children choose. It's really grounded in the biological makeup. So children can range from being extremely outgoing and adventurous to being really shy and upset around new people in their environments. So let's keep thinking about this. So these are the different temperament traits from Stella and Chess in 1956. Can you believe it or not? They actually defined temperament according to 9 different categories. So you'll see all of those on the screen. So we have the activity level, that is how active a child is generally, distractibility, how easily distracted a child can be or drawn away from a task. We have intensity. So this is the degree of reaction, whether positive or negative to a stimulus, regular rarity, predictability of those biological functions like sleeping, eating, sensory threshold. That's really how sensitive a child is to a physical stimuli or the amount of stimulation that they may need to register a response. Approach, withdrawal, that's how a child reacts to new situations or people. So remember that as you get new children in your care, because that is a part of their temperament too. Um, Adaptability, this is how easily a child adapts to transitions and changes. Again, that's a big one for children in childcare. Persistence, this is how frustrated a child becomes when faced with a challenging task. Mood, this is a tendency to approach the world in a primarily positive or negative way. So I'm going to stop sharing for a second because we actually shared a handout with you, and this is all about um, identifying temperament. And let me just pull that up really quick. Okay. All right, so this is the handout. And so what I would suggest, a great way to use this, you can use this for yourself and a child in your care. You can use this with parents and their children too, because it's a great way to really think about the goodness of it and how we can help support families and children. Okay, so let's think about distractibility, for example. So remember, that is how easily a child's attention is withdrawn from a task. We all know that children get distracted usually pretty easily, but let's just envision this. Okay, so think about a child in your care, and I just want you to visually mark where that child would be. So let's just say a child's here, very distractible. And now I want you to think about where you would be and mark that with an O, and you can mark the child with an X so you can see the difference. And let's say that you're really focused. So what this means in reality and practice, let's say that you're completing an activity. You are super focused on getting this activity done because we know that your temperament is really focused. You have a task at hand and you want to complete it. We know that the child is not as focused, right? Because that's where his temperament is. And so he's not excited and he's not or he's more distracted. And so what you would do is you would adjust the way that you are helping to support this child. So let's say he's easily distractible. You might pull in something that he is really interested in or really entice him to stay focused on the task. So let's say he's really interested in dinosaurs and you're making you're doing a craft with cotton balls, for example. So maybe you're going to have a dinosaur there that is, and you're making his house, or he's eating the cotton balls. And so it's something engaging to the child too. So these are just some of the things that you can think about, but I really encourage you to really think about this, try this. If we were in person, we'd go through all of them and try them. But since, we're in this virtual world, this is just how we are. But I would just go ahead and encourage you to go ahead and do that. Okay, let's keep going. Let's look at how temperament shapes behavior, because we said we were going to talk about this, right? So how does this happen? So as I mentioned already, temperament is brain-based, so remember that. But children who have more brain activity occurring in the left area of the brain, they tend to be children who are eager to approach and explore unfamiliar situations and activities, versus children who have more activity in their right frontal brain. They tend to avoid those situations and those objects. At the same time, this is equally important, temperament provides a foundation for personality. So for example, a fearful or cautious temperament, like my son Benjamin, remember I said he was super shy, that can actually predict the development of better self-control. And I can contest to that because he has definitely a lot more self-control than my fireball. So my other son, he's super impulsive, and there's not really a better or worse temperament, because they all both have positives and negatives attributes to both of them. But if temperament is brain based, does this mean that it cannot be influenced by a child's experiences? Absolutely not. So our experiences and what we're doing and how we're supporting children, that can really help shape their temperament, and then in turn shape their behavior. So one way that temperament is really affected by experience is in how people, particularly caregivers, teachers, how they're responding to a child's behavior. So for example, if a child's having difficulty adapting to change, then how you're responding and validating that can have a large impact. So remember I said Benjamin was super shy. And one of the things that we really worked on was having him go up to people. We gave him lots of experiences of going up to people, shake their hand, tell them your name, nice to meet you. And so we really modeled that, and we encouraged it, and we nurtured it for him. And I will tell you, by the time that boy was 7, he was going up and shaking hands on his own. It was just, that was like a proud mom moment. I'm like, oh, yes, he changed. He's really like, that really shaped his temperament. And so you would have just never known he was like this shy kid. And I'm telling you, when I say he was shy, he was shy. He was shy and anxious. Like every time people would come up to him, he would do this thing with the side of his mouth where he would like stick his tongue in his cheek and go, because he was so like nervous and anxious all the time. So that's just, something to think about, that we can really help shape a child's temperament. So really making sure that we're tuning in with them. So Patty, if you want to go on to environment.
Sure, sure. I love hearing stories about your kids, Lisa, because it just makes it so real. And that's
They're
what we
fun.
live with
They're
every
fun, and I
day.
love them.
All right. So the last factor we're going to talk about today is environment. And that was a conversation I've had a lot just in general across the years, but we think about how the environment that we grow up in impacts the development of our brain, the things that children are exposed to. For example, a year ago, we have thought we would have had a picture of a kid with a mask on in this slide like we do. That's the change in our environment. But as we mentioned earlier, it's not just the immaturity of the development of the brain that leads to self-control, but children's experiences of the world have a significant effect on the ability to self-regulate. Think of all the times and experiences we've had as adults, and we still have a hard time adapting and adjusting. So the most foundational factor in a child's environment is the quality of those early attachments. And I will tell you, there is a whole social emotional unit to this curriculum that really partners really well with this behavioral unit as well, because it really digs into more about attachments and stress and how that can really impact brain development. But we know that research shows that the security of attachment in early childhood is associated with the development of the range of positive personality characteristics and social skills, including greater problem solving skills and social problem solving skills, understanding emotions of your own and that of others, stronger peer relationships, and greater self-confidence. How that connects to behavior is that the security of the attachment has also shown to predict self-control in children 6 years later. So that attachment is really, really important. And when we think about social emotional development and attachment, and Lisa can tell you with her infant mental health background, those attachments have to happen early on, from the very beginning that that baby comes out of the womb. So, and that can be a predictor for that self-control when we see self-control for children as they grow older. Additionally, children with those secure attachments also do better on attention and self control tasks, which is really, really important when we think about it. So, in addition to the importance of strong early attachment, research has also demonstrated that the quality of maternal caregiving during infancy also has an effect on the developing brain. This, in turn, then affects child's emotional regulation, their cognitive flexibility, which how they adapt to different situations, social communication and memory. And sensitive caregiving also protects children from the stress reactions that can negatively affect the developing brain. So you think about all the different stressors in the environment, particularly in the last year. We go back to Fatima and Zane's example in the beginning. There was a lot of stress in that environment that Zane hadn't experienced before the pandemic hit. So that ability that have that those strong attachments, if he had those, will help protect him and help him understand and be able to regulate that stress, those stress factors that he's feeling from his environment. So here's some more food for thought. Children living in poverty are at greater risk for developing self-control. Basic stressors such as living in chaotic and unstable environments can affect a child's ability to develop self-regulation. And these stressors can have a negative effect on parts of the developing brain, which then affects the development of self-regulation. So we hear self-regulation a lot over and over and over again as that plays a part in developing, and as that plays a part in behavior and how the brain is developing. So the parent-child interaction is also a transactional process. The way a child behaves and influences the parent's response and vice versa. Children with a temperament that's more negative or have poorer self-control may receive more negative parenting in response to that behavior. Negative interaction patterns can then become more difficult to change, putting children at higher risk for behavioral challenges. Other experiences that negatively affect development could obviously include alcohol exposure during pregnancies, which could lead to abnormalities in the development of the brain. Obviously, abuse and neglect by a parent increases the stress hormones in the brain, which interferes with the brain and the development in utero. And both of these experiences interfere with the development of self-control. All of that sounds really negative, right? But that doesn't mean that things can't change. So when we have children that are in those environments that may be having a lot more stressors, we are then going to then talk about the impact of change and how that can impact us. Thanks for switching that slide. Nice segue there, Lisa.
I felt it coming. I heard it. Yes.
So it all goes without saying, as we've said many times, that we've experienced a huge change in our environment over the course of the last year. So Lisa, tell me some ways that you support your families, both those that you work with and perhaps your own family, particularly your own family, because you've mentioned them a lot during the last several months.
I think first and foremost, I always am trying to remember about self-care. I'm the worst at practicing self-care, but I know that in order for me to give myself, I have to make sure that I'm practicing self-care. And that's probably the hardest part for me because I'm not always doing it. And then, that way for my children, I'm a little bit more tuned in than worn out all the time. And I can put money in, deposit some of that love in the piggy bank. I don't know if you've ever heard of that saying where, like just envision a piggy bank and we're depositing some love into that. And is our piggy bank full? Because when a child's piggy bank is full, then they're able to adapt more. But as a parent, it's hard to deposit that love when I'm feeling stressed. So the first thing I have to do is make sure that I'm taking care of myself.
How many times have we heard the word here's another word that's come out, quarantired. Instead of quarantined, and I think actually it was one of our colleagues, Lisa, that brought it to my attention months ago that we're quarantired. And I think we've all experienced that at some part. And what you just mentioned, it's hard to pull from yourself to give to yourself when you're already tired and exhausted yourself to begin with. So there's been a lot of things that we've had to really think back to. And I'm the reverse. I think I do self-care really well, but I had a conversation this past weekend that Somebody asked me and I was like, yeah, I think I do self-care really well, but I'm not going to lie. This last year's been challenging, really challenging for even people that know that, like, I
Exactly.
practice yoga, I read, I give myself downtime, but it's still been tired because, when you have such a dramatic shift, it's really, really hard to shift to that. But it's really hard for the kids as well. So hopefully as we, emerge back into a different life after COVID, post COVID, what things are going to look like for those kids. But we also think about other changes that kids deal with every day aside from the pandemic. A loss of a family member, a loss of a pet, a change in a daycare provider or a preschool teacher, or a move to a new home or a neighborhood, separation or divorce of parents, many others. All those situations often result in feelings of insecurity, sadness, fear, anger, and they may cause the children to become clingy, withdrawn, very distracted. And like we saw with the Fatima and Zayn example in the beginning, some frustration and distress that comes out in terms of challenging behaviors. And it makes it harder for them to manage their meltdowns. They become anxious and overactive and aggressive. So that ongoing stress in the brain makes it very difficult for children to maintain that self control. So, what I want you guys to think about to take away from all these changes are, what about those changes in the child's environment that could be impacting that child's behavior? So, when I've worked with preschool teachers or Head Start teachers or childcare providers in the past, when they say to me, Joey has been hitting every day, all day long for the last 2 weeks, my first question is going to be, have you explored what changed in Joey's environment? Was there a change in his home? Was there a change in his routine? Was there some sort of change that happened in his world? And I mean all parts of his world, not just in that setting that you're with him, that may have impacted him and caused those behaviors. Like we said in the beginning, behaviors don't happen without reason. There's always a meaning behind them. So when we think about environment, you want to look at what's going on for that child and if there's any changes first before you think that, oh, Joey is just going through this phase where he's hitting everybody. There's a reason behind that.
You know what, Patty? I was just
So,
thinking
yeah.
about like our introduction slide. We had that iceberg picture. And so what you're talking
Mhm,
about is
mhm,
that hitting, that's the tip of the iceberg. That's what you're seeing. And so, but what's
mhm,
underneath of that iceberg, what's all of those
mhm.
hidden things that are going on that can impact that behavior, that's what we need to find out. So that's a good
Yeah.
point.
Yeah. And that's sometimes really hard to remember in the heat of the moment. When Joey is pounding on you and hitting you, you're not thinking, "Oh my gosh, I need to ask mom or dad what happened, what's going on at home if something's changed." But those are the things that we have to remind ourselves about. We can go on to the next slide. So let's review before we move on to our last bit here. There's three key factors that influence behavior, and you can type them into the chat if you want and write them down in your notes, whatever you might want to be. But we've got some reminders from the pictures here on the slide. But I'll
And we
give you
do
the
have a
answers.
brochure. We do have a
Oh, yes,
brochure
you do have your
handout.
brochure.
Yes, it's listed.
Exactly. So they're there. So obviously development, that first one on the left, the cute little babies crawling and walking. Then we have temperament, which is represented by the scales there in the center from that temperament scale activity we talked to you about. And then the environment, with those hands holding the little play or clay world, which I think is really cute. It's an awesome picture. So those are just some reminders of those. All right, so let's move on to take a look at this quote. And I'm going to read it out loud to you so you can also read along with me on the screen. But when we look at behavior, we stop seeing the child and only look with an intent to judge whether we need to reward or punish. When we look behind the behavior, we see that little struggling human, our little human, who needs our help with something. So, Lisa, what do you think? What are your thoughts after you hear or read that quote?
Well, first, I'm just going to judge us because I realized that we forgot to put the D in needs. And so that's why
Oops.
I'm such a like, I'm like, oh.
Oops.
So if
And that
anybody
was the
else has a
first typo.
grammar, yeah, and you guys
Hey, if we
caught
get through
it, we
23
noticed it
slides
too.
with a typo, we're doing pretty good.
Yes. But I guess, like when I look at this, I just think, gosh, like it's so easy for us to judge people. And we do this. It's not even just children. Like we do this all the time in our lives. Like we assume, we automatically assume like, oh, that's a bad behavior, or they have bad parents. Oh, their parents don't discipline them. We assume these things, and that we lose ourselves then, because we lose that empathy. We lose that voice of figuring out what's really going on, because that parent has their own stressors. They have their own things that they're dealing with. That child has their own things that they're dealing with.
Mhm.
We have our own things that we're dealing with. And so all of
Mhm.
that impacts this whole situation. And so I just think that, you know, the biggest takeaway for me is to be less judgmental, to not assume, and to be
Mhm.
empathetic.
Mhm. Absolutely, absolutely. And the big crust of all of that, everything you just said, is no child misbehaves on purpose. Like, behavior has meaning. So, some children may have learned that behaviors get them the attention they want. Like, how many know that a temper tantrum, kids will temper tantrum because they know it will get a response. Um, but they don't misbehave without a reason. So that's the biggest thing we want you to take away is children need guidance and support, not judgment. And we are really good judges. We just judged ourselves because we've missed a typo that we've presented in this slide. We're like, it's like the
Okay,
third
we'll judge
session, I think.
ourselves.
And we probably edited it so many times and we still missed it every single time.
But see,
So,
that's a great learning experience, because we will always admit our flaws. We're not
yes,
perfect either.
exactly.
That's why practice
Exactly.
doesn't make perfect, because nobody's perfect.
Exactly. Exactly. But the other thing that we want you to take away is feelings aren't the problem. It's what we do with our feelings that can become problematic. So clearly, Lisa and I's feelings weren't hurt that neither one of us caught a typo there. But clearly, because we're laughing about it. But even with children, feelings that how they feel and their emotions that they display when they're having challenging behaviors are not the problem. It's how we respond to that as well. So let's go on to another quote. So don't just do something, stand there. So Lisa, what's that mean to you and how can we help parents understand
Yeah, so
this?
I automatically put my infant mental health hat on here, because I just think, okay, what's going on? And I want to know, how is the child feeling right now? What's going on in this picture? How's the parent feeling? And I want to explore that. And by standing here, I can observe a lot more and be open to accessing some of that top functioning in my own brain to be able to best support this child too.
Excellent, excellent. And how many of you like read that quote and you go, wait a minute, that's not right. It's supposed to be just do something, don't stand there. Right? I always like to tell parents that, when I coached parents through children that were having temper tantrum on their kitchen floor, like I would often say, as long as they're not hurting themselves, hurting anyone around them, or there's nothing near them within their vicinity that could hurt them or someone around them, they're okay. They can sit there and scream and cry, and you can walk around the corner and keep one eye on them to make sure they're still safe and they're okay. And sometimes by doing that, you're allowing yourself to calm down so that you can respond in a way that's not going to continue to heighten their temper tantrum and whatever they're upset about. Because when you go up, they go up, and then it becomes a no-win situation. So we're going to talk about some self-care in a few seconds. But yeah, that quote is written differently on purpose. Just put it that way. Okay. All right.
Right. So now let's talk about tuning into our triggers. We're not going to go too much in depth of this, just because we want to make sure we get to some of the strategies. But one of the biggest things to thinking about this is reflection. You have to constantly reflect and be able and willing to learn and grow in order to best support a child. So what do I mean by that? What I mean is, think about think about this little child. Let's say Jonathan, he just got dropped off and you guys are getting ready to transition and he spits on you. Like, you have to know what your gut responses are. So what would your gut response be, Patty, if your immediate gut response if you got spit in the face?
Well, I would be like, ew, that's gross.
Probably right now, sanitizer. Wipes on my face.
especially in COVID times. But I think I'd be beyond that, but I wouldn't say that out loud. But my first thing would be like, no, Jonathan, we don't spit on people. That would be the first thing that would come
Mhm.
out of my mouth without even thinking, because I would
Yes.
want to correct the behavior. And again, I'm like air quoting correct in behavior, because I wouldn't be thinking why he's doing that right away.
Right.
I wouldn't, because that's not their natural inclination to
And
do.
that's the point of the activity. So then you want to think about, okay, if I had 5 minutes to think, what would I do? And your response is going to be so different. Because think about it. there have been so many times that people have done things to anger or upset us as adults. And what do they always tell us, our friends? They say, okay, like, just go take some time for yourself before you respond, go sleep it off. So you've had time to cool down, right? Because really, it's not about cooling down, it's about getting your stress level reduced so that way you can, because remember, when you're focused on those big emotions, you're right here. This is the part of your brain that you're focused on. You're focused on your breathing and your heartbeat. And so you can't access that top functioning, that executive control where you can actually problem solve and figure out like, oh, hey, like I probably shouldn't do this. This is probably the better approach to it, and navigate that situation. So you have to calm your bottom functioning down first, right? And calm those big emotions before you can access that executive control. And that's what that time does. It gives you that time to do it. Now, you don't always have that time to do it, especially because it just comes in the heat of the moment. So that's why I say, like, practice and really reflect on what are your triggers. Find out, like, what is it that really upsets you? What's your gut response that's like, okay, I need to probably work on that a little bit more, because my gut response is to be like, okay, like, you need to go over there away from me because I don't
Mhm.
like that. And so really understanding that. Okay. What I know, I've been talking a lot about tolerable, well, I've really been talking about stress, but I just want to demonstrate a quick activity just to give you a visual. So hold on, let me move this bowl over here because I'm going to actually do it this time. All right. So let's imagine that any liquid that goes into this cup, that is your tolerable stress. That is what your body can allow you to do. Let me stop sharing really quick. Okay. So that's how much stress you can hold. This is your tolerable stress. Anything over that, that's your toxic stress. Let's think about Fatima and Zane, okay? So Fatima is stressed, one, because of COVID. She's also stressed because his childcare temporarily closed. She's trying to work. Her husband has long hours. Zane has early intervention services. His behaviors are getting out of control. And then it starts to overflow. And that's where it becomes toxic. So his stress, her stress, it's all toxic. And so that is something really important for us to think about, because we don't want our tolerable stress to overflow. We don't want that for our parents. We don't want that for the children that we're providing, and we don't want that for ourselves. And so you really got to think about how you're going to manage that stress, because as soon as your toxic stress overflows, then you are just reacting. And that's where it gets a lot harder than to support a child, because we're not accessing some of that top functioning again. All right, let me go back to the screen and share. Okay, you can see it, Patty?
Yep, you're
Okay,
good.
so let's go on to reducing stress.
Okay, so what I want you guys to take note of, and you can make your own notes on your own paper, but I want you to think of some ways that you calm yourself down. Which I think in the last year we've all really had to think about that, more so than what we did before because of all the challenges we faced. But once you think about what triggers you and what causes your stress, I want you to think of ways that you calm back down. So, Lisa, what are some ways that you calm yourself
I told you I'm not good at this.
down?
But when I do remember to do this, I've been like trying to journal a lot more, and I've been taking a
Mhm.
lot more walks outside to kind of just get away from my space and really kind of reflect on what's going on, and trying to tune into how I'm feeling today to really help.
And I think you just hit it. You're getting away from your space. We talked about this before the session started. When I started working from home, Lisa's always worked from home, or at least for the last several years. When I started working from home full time with the pandemic, I went from commuting 2 hours a day to suddenly having 2 hours of my life back, which was weird in the beginning. But I quickly learned that if I took a walk like 10 minutes after I logged off for the day, that was my new commuting time, and it was life changing in the sense that it was taking me away from my space, which my office is now in my home, which it is for a lot of you as well. And my home was always my place to relax. It wasn't always the same space as my office. So that act of getting out for an hour at the end of my day when I normally would have been sitting in a car was definitely how I calmed myself down and helped shifting from my work day to my home life. Obviously yoga, I mentioned that earlier, but reading is also another thing I do. I was just talking to my mom last night about all the books that she and I have both read in the last few months, just as ways to calm ourselves down and a chance to escape, even if it's just for 10-20 minutes, which is really helpful. So keep those in mind, that there are ways that you need to learn how to de-stress and calm yourself down. And by doing that, you're helping the children that you're working with and the families you're working with, and helping them identify how they do that as well.
And write it
All
down
right.
and create a vision board. That's what I did.
There
Vision
you
board.
go.
Vision board.
So let's get into the last bit, which is our challenging behaviors. And we've listed some strategies up here on the screen. They're also in your handout that we gave to you guys. But the first strategy is that open communication with parents and caregivers. I can't stress to you how important it is to really develop that strong rapport from the get-go. Especially in early intervention, we were meeting families, brand new babies, right at the get-go. They're usually very emotional given whatever's going on. Developing a strong, trusting relationship with them is really, really important as well, because that will support that open communication when you start to work with things around challenging behaviors. Then we also have, you want to look for patterns in the child's behavior. Like I mentioned before, when we noticed, say Joey was hitting every day for 2 weeks. Well, what changed? What was the pattern of it? How often is he hitting? What was going on before you noticed the hitting started happening? We talk about antecedents, and there's a thing called ABC charts, which we're not going to have time to get into today, but antecedents are the things that are happening before the behavior occurs. So really understanding what is the meaning behind that behavior will help you understand what those patterns might be. Patterns can really help you identify then also what the consequences or the consistent responses is what I like to use to call. C stands for consequences. I like consistent responses because I think it just sounds nicer. But and then lastly, adapt the environment and structure. Maybe there are things in that environment that need to change for the child, that perhaps sitting in circle time would be helpful for that child to sit in a chair as opposed to on a square on the floor, just because they're more comfortable sitting in a chair. Those are things that allow them still to participate in the activity with their peers. They just may need a little bit of an adaptation to make them more comfortable in that environment. And those are totally appropriate things that you can do. So there's also some strategies, and you can go to the next slide, Lisa, for managing challenging behaviors. Obviously remaining calm, and that's where that discipline and understanding how you calm yourself down is going to really come into play. But the calmer you are, the calmer and the quicker the child will become calmer faster. So it's really, really important to try to maintain your cool as best as you can, even if that means taking a minute or two to step out into the other room before you come back to respond. Have a plan and communicate it. Communicate it with your co-teacher, communicate it with if it's two parents, make sure the parents are hopefully on the same page, that they've communicated to themselves or to each other how they're going to respond when a challenging behavior occurs. It's really, really important. I can tell you years of working with early intervention, making sure that mom and dad or whoever the two caregivers are in the scenario, grandma, whatever it might be, that they're on the same page, at least as much as possible. Because that consistency is really important. But you also, when you're developing that plan, make sure you validate the child's feelings. Their emotions are important. They really, really are important, is how they're feeling, and making sure that they know that how they feel, that you know how they feel, is really important. But you can also set the limit. You can tell them, you don't want them to feel overwhelmed or shamed, but you can set the limit as to what they can do and what they need to maybe have a little bit more patience around, such as, waiting our turn and things like that, so that they understand what the rules are in certain situations. Offer acceptable choices when possible. I had, a parent that'd be like, oh, well, if you behave today, we're going to go to Disney World this summer. Okay, that is like a way long term, that kid is not thinking about something 4 months from now. And Disney World's a really huge reward. You want to make things that are really acceptable and reasonable, and things that you can make sure you can follow through with as well. But that also gives a child a sense of control, so that they can they can have that self-regulation come into play. Also allow them space for recovery. How many times have you had an argument with another person and you're like, you know what, I need 30 minutes to not be in your space so I can recover and come back and have a rational conversation? Children need that as well. That is really, really important for them to have that period of time to be able to recover on their own. And then if you're going to debrief, do it when they're calm. It's not appropriate to be doing it when they're still escalating or they're still really upset about something. You want to make sure that they're calm so they can actually hear what you're saying and what you're talking about. All
Yeah.
right.
The only other thing I wanted to add, we're going to drop this in chat. There is Marcy Meltzer. She has this video on overcoming tantrums, and I love it. And so I'm going to just attach the blog post into the chat box. But one of the things that I love the most about it is that she talks about when children, like, so think about a child who falls and scrapes their knee, and they're so upset. And so, like, we as caregivers, we go up to them and we're like, oh my goodness, we're validating their feelings and their emotions. Like, are you okay? We're concerned, right, for them. And we help them and we support them and we guide them through that process. Now, think
Mhm.
about a child that's just having a tantrum because they didn't get a cookie at snack time. And then we respond a little bit differently, right? Because there's like a control factor there. And we're like, nope, sorry, get over it. And so the way that we respond is completely different in both of those situations. But it's important to remember that in both of those situations, the way the child feels is the exact same. So the child still feels like it's as if they fell and they hurt and they got a boo-boo for tantrums. So we'll post that there, but read it because I think it's really just a great way to think about it and be a little bit more intuitive too.
Awesome. All right. So the last thing we're going to go over is when we think about challenging behaviors, I get a lot of the questions, particularly from childcare providers, is when do we make a referral or even Head Start teachers or preschool teachers? So some things that I want you to keep in mind before you just jump the gun and say, I need to make a referral to the public school system, to Child Find or whatever you guys call it in your area, or even early intervention, is you want to make note, is this a marked change in a child's behavior? Is this something that is new, that is not, has not been occurring for a while, and it's very dramatic? It's like, oh, suddenly the child is very quiet and withdrawn when they used to be very sociable, or they're really starting to develop some aggression type behaviors, hitting, throwing, things like that that have been happening really regularly for a period of time that weren't happening before. And again, you want to go back to figuring out, is there changes in their environment? Because that's going to be the first thing that early intervention and the school system is going to ask before they do assessments is, what are those background changes? What's going on in that environment? What has been happening to change that behavior? What was going on before? And I'm even going to go into how often, consistency, and things like that, because a child that hits once or twice a day is not going to be as significant as a child that's hitting, 50, 60 times in an hour, things like that. Another factor to consider is the behavior interfering with their ability to learn in the classroom alongside their peers? Is it interfering with their ability to develop relationships with their peers or function effectively in their environment, whether it be a classroom, a childcare center, or wherever it might be? Is that behavior getting in the way of that child being able to function in a way that would be developmentally appropriate? And then lastly, it's really important to note if the child is experiencing multiple problems simultaneously. Are they having a hard time getting along with children? But then you also learn from the child's mom that the child has started wetting the bed at night. So something is going on with that child, and you want to be able to link those things together when you're making that referral. So always remember that you want to consult with the child's family and the team members and colleagues if you're trying to figure out the root cause behind a child's behavior, because sometimes others can also provide a different perspective and ask questions that you hadn't thought to ask. And I'll tell you, even after doing this for 20 some odd years, there's always a question that somebody comes up with that I haven't thought of when you go over this with your peers. So they can be really good people to bounce things off of, and that can be really helpful when you're thinking about challenging behaviors.
Yeah.
All right,
I was just going
so
to
go
add,
ahead,
if
Lisa.
you do ever suspect a delay, just a developmental delay, in Virginia, a child has to have a 25% developmental delay, any kind of atypical behavior, or a diagnosed condition in order to qualify for early intervention services. But anybody can make that referral too, and you can contact your local early intervention system. So I just wanted to add that little piece too.
Absolutely. So let's go. And for the sake of time, I'm not going to read the takeaways that are on the screen because you guys can obviously read the things that we covered today. But I think we are going to have a moment for open questions and answers in the live recording, so you guys can certainly ask our questions here. But We have our emails up on the screen, and Lisa's also going to drop the Virginia Early Intervention Professional Development webpage in through the chat, as well as their social media links. They have lots of great resources there. And obviously, both of us are happy to answer any questions you have. Just feel free to shoot us an email.
And free resources.
Thank you for joining us. I'm sorry.
And free resources. Everybody likes
Absolutely.
Free. Yes.
Oh yeah.
Thank you so much. And I guess we'll talk to you guys
for joining
on the Q&A.
us, guys.
Yep.
Bye.
Bye.